Hello, dental online trainers. Dr. Dennis Hartlieb with you again with another clinical mini tip. Today's mini tip is the analog open tray implant impression technique. In our previous mini tip, you learned how to make the customized impression coping. Now that impression coping has been made on the perfectly sculpted tissue that you were able to create with your provisional, now we want to pick up that impression coping so that we can send that to our lab. So we're going to share with you step by step how I do that today and give you some pointers to make these impressions even easier and more accurate for your lab technician. In today's world, we have three ways we can take impressions of our implants. We can do an open tray impression technique like what I'm going to share with you now. There's also a closed tray technique, which I will use sometimes, and I will typically use the closed tray technique when I'm working with somebody who has a very small mouth and where I'm working into the back of the mouth, and it's hard for me to get in and be able to use this open tray technique. But for an analog impression, I prefer to use this open tray technique. I like the fact of the implant impression coping being more stable in this impression versus a closed tray technique where you have to remove the coping from the implant after the impression and then pop it back into the impression. I'm always nervous that with the closed tray technique, that impression pin is not going to be absolutely positively seated. So I prefer an open tray technique if possible. Also, there's the opportunity for doing digital scan of your implants, and you'll find that information on other mini tips. So today for the open tray, let's move forward. So I have my model with my customized impression post already seated. I'm going to take my impression tray that's perforated. To do the open impression technique, I have to create a hole in the impression tray. I'm going to look in the patient's mouth and I'm going to move the impression tray around until I can see where that impression pin or the screw is coming through. Then I'll use a Sharpie marker to be able to draw on the tray exactly the point where I need to open up the tray to gain access to the screw. So I do it just like that, and then I go into the laboratory and I'm going to open up that area so that I can place my impression and that screw will be coming through that hole that I just created. After we've created that hole, we want to try it in the patient's mouth. My advice to you would be to oversize your hole a little bit. If you have too small of a hole, when the impression tray is filled with the putty material or your impression material, it can be difficult to gauge exactly how to put in that impression tray. And you don't want to be spending too much time trying to get the impression tray moved around, trying to find that hole for the pin to come through. So make your hole a little bit bigger than what you think you need. So there's a little wiggle room, you have a little space to be able to get this tray or the impression pin through the tray. Now once I've had this tried in the mouth, I'm moving the tray around to make sure that it's seated properly. Be careful, you want to make sure that the impression tray is going to cover over those posterior teeth and not going to bind on those. So make sure you have an accurately or appropriately sized tray because you do need to get impression of the posterior teeth so that as they're building up this implant crown, they have a good occlusal index to be able to make sure that they're working out all the functional issues that's necessary when they're making the crown. So in this case, we're just using a little sectional tray. In the mouth, I'd be using a full arch tray, but for this model, it's only a 6-tooth model, so I'm just using a little anterior tray. Okay, I try it on and it feels like it has nice ability for the tray to go through the pin. So it's ready for me to get ready to start taking the impression. So now that we've tried in the tray, let's go ahead and paint the tray with our adhesive, our tray adhesive, so we can get ready for our impression. I want to share with you a tip that I use when I'm doing open tray technique. I use a material it's a flexible rubber dam flowable composite material. The material that I use is called Ginger Guard from Cosmodent. And again, it's just a flexible flowable composite. I'm going to use it over the screw pin, and I'm going to do it for two reasons. Number one, with this material over the screw pin head, it makes it much easier when I'm seating the impression tray because this gives a little bit more height to that screw pin and then it'll sort of pop through the tray a little bit easier for me to identify it as I'm moving the tray into the mouth. Secondly, once I have this through the tray in the mouth and the pin is popping through, I can take off this flexible composite and I'll have a very clean screw head that's easier for me to unscrew when I go to take out the impression. So let me show you how I do that. All right, so I'm going to take this GingerGuard or global flexible composite, and I'm going to create almost like a large bead of the material over the screw head, something like that. This is light curable, so I'll light cure that for 10 seconds. Now it's nice I have this little ball of flexible composite that's sitting over top of my pin, which again is going to make it easier for me to identify as I'm putting the impression tray into the mouth where that pin tip is. And then also it's going to be a nice clean area for me to be able to go in with my driver and loosen the screw before I remove this from the patient's mouth. Now we're ready for impression. Now think about the impression for a second. With the implant impression, we need to be able to capture that impression sort of with two different materials. The first material is going to be a low viscosity or a higher running material, sort of our highly flowable impression material. I need that so I can capture the gingival architecture, the soft tissue, and I also need to be able to capture the facial surface texture, especially on these anterior crowns, or for this anterior implant, to match the anterior teeth. That way my laboratory technician can look at the surface texture and the details, and for that we need the low viscosity or the highly flowable impression material. But the problem with that material is that it's really rubbery. And so if I use that around the impression pin, then the impression pin may not be stable enough and it may just pull through as I take out my impression. So I need some of the same tray material, the heavier body material, around the impression pin. So what I do is I'm going to have two materials that I'm going to use around or in the mouth, and I'm going to have my tray material as one of those materials. Now in practice, I'd have my dental assistant, she would be filling the tray while I'd be working in the mouth. Now I might have a second assistant to help me in the mouth, but many times I'm doing this on my own. So I'm going to play both parts today. I'm going to start out by filling my impression tray with a heavy body material. I'm going to set that to the side. Then I'm going to go to the mouth and I'll show you how I use my light body material, the highly viscous material, around the soft tissue and around the surfaces of the adjoining teeth, and then how I use the heavy body material in a disposable syringe to be able to get in and inject that around the impression coping itself. So let's get going. I'll show you how I do that. So you can see the adhesive is painted on my impression tray. I'm going to start my heavy body material. Make sure you bleed the material to make sure that it's running evenly. And now I'll load the tray. Now this material is Aquasil from Kerr. And you can see it's nice and stiff. It doesn't overflow, so I don't have to worry about it running through the hole that I created for access to remove the screw for the open tray technique. I'm going to set this to the side. Now around the implant itself, I'm going to start out, I'm going to bleed my light body material. Move that to the side. And I want to pick up the gingival architecture and also the surface texture of the neighboring anterior teeth. I'll flip over the model, we'll do the same thing on the palatal. Now at this point, I'm going to pull out my heavy body material in this disposable syringe. I'm going to bleed this material first. I'm going to come in and I want to make sure that I'm engaging into these undercuts, into these retentive areas with this heavy body material. Go back with a little bit more light body material to make sure that I pick up all the surface texture and the occlusal aspects of the neighboring teeth. And then as I go in with my impression tray, I'm going to be looking for that ball to come through that surface. And I can see that ball of material as it's coming through. And I can use an explorer, and I will just poke my explorer into that flowable composite. And I have a nice clean thread there, a nice clean screw for my driver to go in to be able to remove that after the impression material is set up. With this impression material, it's a fast set Aquasil. It's a 4-minute set time. So 2 minutes working time, 2 minutes in the mouth. Now that the material is set up, we can go ahead and we can see how clean the screw is, which is really nice, makes it much easier for when we're going in with our driver. And we'll loosen that up. Another tip for you, when I'm unscrewing the screw, I'm listening for a little click. When you hear the little click or you feel it, it's when the screw is completely disengaged and you know that it's loosened. I can also tell as I start to remove it, you can tell that it's disengaged now. All right, we'll go ahead and carefully remove the impression. All right, we've taken off the impression. Let's take a look. With this Aquasil, what's great is you can see how you get these great fins where the material has really great tear resistance. So on this model, it's going way up underneath, and even on this, around the neighboring central incisor, there's this very large fin. That's just a sort of one of the great properties of Aquasil. It's got this great tear strength. But anyhow, so the implant impression coping is nice and stable. We're able to remove this, and now we're able to send this off to the laboratory, where they'll place the fixture analog before they pour up the model, so then they can go ahead and start working on the final crown. In the meanwhile, once this has been removed, I'm going to immediately place the patient's provisional back in place so that we can keep that soft tissue supported that we worked so hard to create, as you remember from the implant provisional exercise. All right, dental online trainers, that wraps up the open tray implant impression technique. I hope you found this mini tip valuable and something that you can use in your clinical practice daily. That's it for now. Thank you for joining us. Yours for Better Dentistry, I'm Dennis Hartlieb.